It's your health, it's your life on the Astral Radio Network. Now, here's Dr. Don.
Welcome, listeners, to another program of Empowered Health. It's your health, it's your life. Now, we hope you're going to enjoy tuning in to us each and every Monday night here at 6 p.m. And from time to time, you can also catch it on the internet, particularly live on our radio shows. You can catch our live broadcasts on the internet, www.am650radio.com. So send an email to your friends out of town, phone somebody if you need to, because if you can't hear us on the radio, you can watch us and listen to us on the internet. And of course, if you like to watch us on the internet at the same time, you may have your radio on. That's a cool thing too, because sometimes we have some rather educational images or some of the links to some of our information that we can show you as well. I'm Dr. Don Nixdorf, chiropractor these past 40 years and executive director of the BC Chiropractic Association and College of Chiropractors. BC's chiropractors are sponsoring and bringing this program to you, so if you have any questions at any time, remember on a clinical level, speak with your family chiropractor or visit our website, bcchiro.com. You'll find both the regulatory college side as well as the association. And in the association side, you can go to research and other of the information that you have. If some of you are looking at chiropractic as a career, then on the college side, you'll find links about becoming a chiropractic doctor, as well as the accredited chiropractic schools literally around the world in many different countries. Now, in addition to listening to us, we also welcome your phone calls, particularly on tonight's segment. We're going to have 3 of our chiropractic colleagues and experts dealing with spine and spine-related conditions. And you might want to take down the phone number right now. Vancouver, the local call number is 604-280-0650. That's 604-280-0650. Long distance toll free, it's 1-877 and then 280-0650. Now, if you're shy or you just want us to think about the question that you want us to address, we have your email that you can send us, radio, R-A-D-I-O, radio, at bcchiro, that's bcchiro.com. We'll get that here at the studio, and we'll take your questions tonight. So, Michelle, it's rather cold, dark, slippery from early morning to late evening, and I know, tragically, there's going to be everything from a few car crashes that are going to result in some spine injuries, and sadly, some of our listeners may have had to do a little breaking of the ice, maybe some snow shoveling somewhere.
And maybe some slips and falls.
Slips and falls, so we do not wish bad on anyone, but when injuries happen, that's when your family chiropractor is going to be ready to help you. So what have we got tonight for that?
Well, you've kind of launched us off into our topic there. So do you experience headaches? What about low back pain? Is there discomfort in your mid-back or ribs? Well, the problem, like Dr. Don mentioned, could be in your spine. So tonight we're joined by 3 BC chiropractic doctors, Dr. Shawn Thomas, Dr. Lydia Mickelson, and Dr. Jerome Fryer, to discuss the 3 areas of your spine and what you can do to ensure they remain healthy through all stages of life.
Now, we're going to start off at the top of the head and work our way down to your bum or hips or legs, however you want to identify that. And most people think about backs usually in the context around the lower back. So if I go up to 10 people on the street and say, hey, where's your back? Most of them are going to kind of put their hand around where their belt line is. However, as we talk about on the TV show The Empowered Health, and as we've talked about to employers in BC, you have a back. And that starts with the skull all the way down to the pelvis, 24 bones. So our first doctor tonight is joining us from Nanaimo, Dr. Shawn Thomas. He's a chiropractic doctor in Nanaimo, as we mentioned. He also has been contributing to research in the area of the cervical spine, and he also is involved in his community with the local charity, the Child Development Center, as well as helping people with the, I think they call it now, the Silly Boat Regatta that helps autism, speech issues with physio and other speech therapy. So welcome, Dr. Thomas.
Thank you, Dr. Don.
So, Dr. Thomas, what happened in the snow? Was it a crisis over there for your patients that phoned you today?
Well, it was a couple of days ago, but I think the rain has washed a lot of it away, so I think we're doing okay now.
All right. So you're one of our colleagues tonight that has taken time from your practice and whatever else you do on Monday nights to come on the air tonight. And what we want to do, amongst other things, is we want to give an idea to our listeners what happens in the area of the neck particularly that your patients commonly call you for to come in and make an appointment, and walk us a little bit through that initial experience that you have with a new patient and a new patient has with you that happens with sort of neck and head areas. So for the listeners, we're talking about the top of your spine, commonly called the neck. There's 7 bones in there. So Dr. Thomas, we're going to put your website, I think we have it here, and it's
myspine.ca.
Great. That's why Michelle's here, to remind me the things that I forget. So we'll probably put on the internet if we can. Yep, we can. So we're going to put on for our internet listeners www.myspine.ca, and you're going to see the information we're talking about with our first guest tonight, Dr. Thomas. So Dr. Thomas, first question is, phone rings this morning, patient says, I need an appointment, can you help me? They come into you. What are some of the typical things that your new patients come to you with in regards to neck and head conditions?
Well, there's a variety of conditions, but people come in with neck pain. Sometimes they have migraine headaches, just cluster headaches or tension headaches. Sometimes, since the neck controls the arm and the upper extremity or the upper arm, sometimes there's numbness and tingling or loss of power, loss of range of motion in the arm, and also after car accidents, as you mentioned in this ice, sometimes there's a loss of range of motion. So sometimes they can't turn their head, or it's completely locked a certain way and they can't unlock it. So that's some of the situations that people come to our office with.
So people often say, well, I don't think I have a neck problem, but I've got a headache. What is it about the neck that people don't always think about in association with their symptoms? So for the person who wakes up in the middle of the night and they shake their arms and hands, for the person, like you said, who's got the headache, why is it that they don't associate their neck necessarily when they come and see you?
Well, I think it's because it's it's so far away. They think their eyes, maybe they're sensitive to light, or maybe they're having problem concentrating, or have a little bit of brain fog, or maybe they have ringing in the ears. And a lot of times people, will go to the doctor, their physician, and there's no serious problem there, and they hopefully will, resolve it with a medication. But oftentimes it's really that your head is not on straight. Your head is actually about 10 to 14 pounds, and it sits on this little bone. It's about 10 ounces. And that bone is called the atlas bone.
And that's an important one because of the movement and weight bearing it does on the skull and the brain stem squeezing through there.
Exactly. And as you mentioned, there's 24 vertebrae within the spine, but there's actually only 22 discs, and that's those little squishy areas in between the vertebrae. And, that becomes a little bit more critical of an area in relation to keeping the head range of motion. So when there's no disc there, you actually have a higher possibility of injury in that area, and then your head comes off center. And it actually is called subluxation, as all chiropractors deal with. But when the atlas subluxates, it actually can put pressure in the upper neck that cause a lot of migraines and a lot of other symptoms.
Now, for the patient that comes to you for the first time, in other words, they've just started having these terrible headaches and neck pains, you're going to do an examination, and it's going to identify that the neck is or isn't involved. And sometimes that leads to a differential diagnosis. So with a patient examination, like you mentioned there could be some ear problems, balance problems. In some cases, would you be examining these patients to see if, for example, when I was in full-time practice, a fairly comprehensive examination for a new patient who has no history of seeing anybody for the last year or two, you might do a basic eyes and ears examination, and you end up seeing this great big black and red earplug in their ear. What do you do with that?
Well, sometimes I did have an elderly lady who said she instantly went deaf, and of course I use an auto-ophthalmoscope, which is the machine that you look through the ear, and there it was, a big ball of wax. So I sent her over to the family clinic, and she had the registered nurse or the nurse practitioner just set her up and take it out.
And that took care of half of that problem, and then later, if she had headaches, she was back to you, and it made the diagnosis more clear.
Exactly.
Now, what's your experience with patients who may not always sort of come in within the first week or 2 weeks of having neck pain and headaches? What do you typically see with patients who come to you and they say, well, I've been having these headaches for about 6 months and nothing's helping? What are the sort of things that these people have been trying prior to seeing you?
Well, they usually have been to their doctor, and well, first they've usually tried the over-the-counter medication, the aspirin and Tylenol or some sort of Motrin or something over-the-counter, and sometimes they used some little bit of modalities like ice and heat. Sometimes, of course, there's other things in the natural centers, Trameal and different other chemicals that help take the tension off, or muscle relaxants. They make it to their doctor, and sometimes if it is a prescribable thing, the doctor will recommend Tylenol 3s for more intense pain, or sometimes they're diagnosed morphine because they can't, are in intense pain, or sometimes if it is diagnosed as a migraine, they get special medications, which are like Imitrex, which is a common one of the family of the triptans. So it's so those are the medications they do, but sometimes they're either very expensive medications, and of course, the overuse of it never seeming to solve the problem.
So with these patients, when they come to you, the differential diagnosis has already almost sometimes been made, meaning that they've seen everybody, done everything, it's still a problem, and then they'll get a referral from their family friend, coworker, or they just may find you in the clinic, and then off they come. So what's the typical experience, if there is a typical experience, that you would say to this patient? So you've examined them, you've decided this is a spine and spine-related condition that probably is resulting in their headaches. What are you telling the patient is their expectation in terms of outcomes? Are we going to treat you for a month before the headache goes away, or is it a week before the headache goes away? What would the patient normally expect?
Well,
given that there's no guarantees in healthcare.
Right. Well, there's a variety of different treatment plans or plans for care that we come up with based on the severity of the symptoms. But we will do, after the examination, if I think it's necessary, we'll do a series of upper cervical x-rays that was designed to make sure we have the proper alignment of the patient while they're seated. And then I'll analyze those films and report back to them in a report of findings to show that their upper neck is distorted or twisted in some format, which is
now we should let me just interrupt you there, because we don't want to give too scary a picture to our listeners here that somehow under the skin their spine is grossly twisted and distorted. These are terms that you and I as clinicians have a certain value to, but we have to sort of paint that picture a little different for the patient.
Right. It's leaning to a certain point, and there's stress on the ligaments and there's stress on the nerves. So it's not grossly twisted or dislocated.
Right.
But it is a chiropractic term, subluxated, so less than dislocation, that puts pressure on nerves and interferes with communication to the brain and all of the parts of the upper body. So.
Now, I'm really glad you used the word subluxated or subluxation, because there's a great deal of confusion about what are terms unique to different professions, whether it's medicine, dentistry, physiotherapy, podiatry, optometry. And subluxation is, I think it's fair to say, and then you jump in here in a moment here, but subluxation is fair to say that we're talking about an involvement of two or more vertebrae in a person's spine as being associated with whatever their symptoms and complaint and problems is. And that's separate from whether or not you've got a fever, an infection, a broken leg, or having a heart attack. So we're trying to paint a picture here that when a chiropractic doctor uses the word subluxation, he or she is really talking about a condition that involves two or more vertebrae in the spine, that the assessment, case history, and diagnosis is going to lead to the care. Have I put too many words in your mouth?
No, that's exactly right.
Okay. Because I know that you and probably many of our colleagues and people, because when people aren't having any health problems, and they don't want to necessarily understand this, and when they're in pain they don't want encyclopedic education. But whenever there's an opportunity, it's important to put in context what in this case our listeners tonight are going to find. So I think we were saying about how long it might take for this patient who called you up. They got a bad migraine, and they're suffering. So we're going to hear the answer to that in just a moment. So you're listening to the Dr. Don Show live on AM 650.
There's lots more still ahead. This is the Astral Radio Network and the Dr. Don Show. It's your health. It's